Northwest Premier Lazarus Mokgosi, in his capacity as the chair of the Provincial Council on AIDS, will today lead the commemoration of World TB Day in Ventersdorp. The official World TB Day, though, is marked on Monday. Watching the story is SABC News Reporter Sentleeng Lehihi, who joins us now live. And Sentleeng, we've heard, of course, that TB is still the leading cause of death in our country, but the minister is worried that not enough people are taking it seriously.
Good morning to you and our viewers, Ayanda. Indeed, TB remains the leading cause of death in South Africa. The World Health Organization said they've seen significant increases in those who are getting treatment. South Africa has shown some significant positive movements in ensuring that those who have not been previously tested are getting tested. But this disease remains quite a debilitating disease in our country, and many of the communities here are really struggling with, the accessibility to, testing, and this has actually necessitated South Africa innovating in apps there, ensuring that people are able to do home screening and also be transferred. Stockpile shortages have also created quite a significant challenge for those.
We initially lost our audio connection to Sentleeng. It seems to be back. Let's continue listening in. All right, it was back, not anymore. We'll try to re-establish the connection with Sentleeng Lehihi and get you a sense of how, of course, that important provincial leg of this initiative is likely to unfold. So stick around for that. Welcome back, and let's take you back to the Northwest. That's where Premier Lazarus Mokgosi, in his capacity as the chair of the Provincial Council on AIDS, will lead the commemoration of World TB Day in Ventersdorp. In fact, the official date is actually observed on Monday. Watching this leg of the story, though, is SABC News reporter Sentleeng Lehihi, who joins us again. And Sentleeng, you are still placing for us the context under which this particular provincial leg of the program is unfolding.
You'll recall that at the height of increased TB incidents, we saw that areas such as the Northwest, particularly given its mining industries, saw the highest rates of these TB incidents. And this made it pivotal for the provincial government and health authorities to ensure that they go not only into these mining communities, but the most rural of the communities. Remembering that TB in itself is mostly crippling to those areas that are struggling with poverty. It does not only take a health toll on them, making them unable to actually provide for themselves and work, but it actually digs deeper in their pockets, with them having to actually seek better accommodation, proper nutrition, and ensure that they keep up with their medication. You'll remember that the World Health Organization said to us that South Africa has made some strides in ensuring that those people who were not identified and were spreading this highly contagious infection are now being identified, and there's also been innovations through an app for people to do home screening and ensure that they get the requisite SMSs when those screenings give a positive result, and they then go to those medical facilities and get their much needed treatment. But as I mentioned to you, we've joined by community members who want to speak about the impact of TB, not only on the patient, but also on the family. As you recall, that there have to be stringent precautions that are taken. You said to me that you have first-hand experience ka bolwetse bo ba TB. My name is
Tabang Kharajani. I'm from Ventersdorp location. I once had an uncle that was affected by tuberculosis. I've seen that to a point like somehow he couldn't afford like the he was supposed to eat for the disease, and like the way he was struggling, like some things he couldn't get for himself because like the TB thing like he couldn't work, and like and on the family, like if family and some of our relatives is affected by the TB, majority of us gonna be affected too, and which will lead us to a point where we are like we will not have like finance or maybe shelter or prevent or because like the first one to come with the disease majority.
Absolutely. You know, he's expanding on that dire reality that's facing many of the communities that find themselves with TB infections in the household. You know, it does not only impact the breadwinner, but the entire family, because they need to find a way to keep afloat and they need to ensure that they themselves are not infected. But we're also going to have an expansion on this. Ntate lo ena o tlhalositse gore mo lapeng la gago o kile wa itemogela TB le kgonne yang go netefatsa gore o na tshwere ke bolwetse bo o kgonne go tsaya treatment ka nako go lwantsha bolwetse bo le gore le lona le ska tshwaetsega.
Bagolo ba ka ba bile ba etsa sure gore motho o kry-a medication ba make sure gore o tsaya medication and that ha tswele kwa ntle a tshele batho ba bang, and then they made the other people aware that he had TB so that the other people didn't come close to him about tshela.
Absolutely. And are you sure that these kind of events are very critical in ensuring that there's proper awareness and making sure that people do exactly what your relative did?
Yes, I am sure. I am very sure about that.
Absolutely. Thank you so much for your time. Those words coming from the youth who have come out in their numbers to such an event. We've also seen stakeholders that are working well together with the provincial government as well as health authorities to ensure that this message of ensuring that people are tested and they get their necessary treatment is out there and heard in numbers. We anticipate that the Premier, Lazarus Mokgosi, will be here in no time and give his official address together with members of the Provincial AIDS Council. From us here in Ventersdorp, back to you in studio.
All right, for that reporting, Sentleeng Lehihi, thanks very much indeed. We'll continue watching that program, of course, as it continues to unfold.